One now moves to behind the patient to evaluate the thyroid, known as the posterior approach. Place your hand midline, as I'm demonstrating here, and when I tell you, Mr. Johnson, I'd like you to swallow. What you'd like to do at this time is to swallow, and as the patient swallows, you're going to move in a rolling motion laterally toward the sternocleidomastoid. Okay. Now remember that patients can only swallow 1 or 2 times, so you only have 2 times to be able to do this. So Mr. Johnson, when I tell you I'd like you to swallow, okay? Mm-hmm. Swallow. And one more time. Okay. Would you mind, Mr. Johnson, just opening your robe a little bit off your shoulders? We're now going to evaluate supraclavicular lymph nodes. And from this position, good. Are you comfortable? Mm-hmm. Good. Here's the clavicles right here. You're going from this position, place your hands in the supraclavicular fossa, and when I tell you, I'd like you to take a nice big breath. Big breath. In, and out. And this is the technique for evaluating supraclavicular lymph nodes. If lymph nodes were present above the clavicle or at the clavicular level, the inhalation would move the lymph nodes up to become more evident over the clavicle. Of course, one of the important rules in physical examination is always keep your fingernails short, because especially on this examination, what you're doing is evaluating the supraclavicular fossa with the pads of your fingers, not jabbing the nails in, which could obviously be uncomfortable. Okay, we're now going to proceed with examination of the back. What I'd like you to do, Mr. Johnson, is to turn around this way so that we can evaluate your back.